How does high potassium affect your heart with CKD? Imagine your heart as a finely tuned machine that relies on electrical signals to keep beating regularly. When potassium levels in your blood become too high, it can throw this delicate system off balance. In people with chronic kidney disease, or CKD, the kidneys struggle to remove excess potassium, which can lead to elevated blood potassium levels, a condition called hyperkalemia. Normally, kidneys help keep potassium within a safe range, which is between 3 and 5 millimoles per liter. But when kidney function declines, potassium can build up in the blood, disrupting the electrical signals that tell the heart when to beat. When potassium levels rise above 5.5 millimoles per liter, hyperkalemia is diagnosed. If levels climb above 6.5, the risk of serious heart problems increases significantly. High potassium can cause irregular heartbeats, known as arrhythmias, which can range from mild to life-threatening. These arrhythmias happen because excess potassium affects how electrical impulses travel through the heart muscle. In some cases, the heart's rhythm can become so disturbed that it results in dangerous conditions like ventricular fibrillation or even a sudden cardiac arrest. Even mild or chronic increases in potassium can gradually weaken the heart over time, making it less efficient and more prone to problems. Symptoms of high potassium might be subtle at first. You could feel weakness, fatigue, muscle cramps, or nausea. Some people experience chest discomfort or trouble breathing. But in severe cases, changes in the heart's electrical activity can be seen on an electrocardiogram or ECG. You might notice peaked T waves, widened QRS complexes, or other abnormal patterns that signal dangerous arrhythmias. These changes can happen suddenly and requiring urgent medical attention to prevent a heart attack or sudden death. For those with CKD, managing potassium levels is especially important because their kidneys can't remove excess potassium effectively. Certain medications like ACE inhibitors or angiotensin receptor blockers, which are often used to protect the heart and kidneys, can raise potassium levels. High potassium diets, constipation, and other health issues like diabetes or heart failure can also worsen hyperkalemia. To keep potassium in check, doctors may recommend dietary adjustments, medications that bind potassium in the gut, or other treatments to help shift potassium back into cells or increase its elimination through dialysis if needed. In the context of kidney health and kidney cancer, maintaining proper potassium balance is vital. If potassium levels become too high, the risk of heart complications rises, which can impact overall health and treatment outcomes. Regular monitoring of blood potassium, adjusting medications carefully, and following dietary guidelines are essential steps. Patients should always work closely with their healthcare team to personalize their treatment plans and prevent dangerous heart effects. In summary, high potassium levels in people with CKD can seriously disturb the heart's electrical system, leading to dangerous arrhythmias and even heart failure. Staying vigilant about potassium levels and managing them properly helps protect the heart and supports overall health. Always consult your healthcare provider for personalized advice and treatment options to keep your heart safe and your kidneys healthy.